Members of the University Social Responsibility Network, all other online audience participants, good day, and welcome to the second week of webinar number 04 of the University Social Responsibility Network series of webinars. This week, the focus is on community engagement using a hybrid approach, specifically community engagement at the University of Pretoria using a hybrid approach. By the way, my name is Duncan. I'm the Vice Principal Academic at the University of Pretoria, and it's my pleasure to chair today's webinar session. By way of introduction, I wish to indicate here that social responsibility and community engagement are not add-ons at the University of Pretoria. For at least the past 20 years, community engagement as a key element of university social responsibility has been a core feature of the University of Pretoria's teaching and learning program and its endeavors as an anchor institution in the communities in which it is located. Now, on the 15th of March 2020, after the positive identification of several cases of COVID-19 infections in South Africa, the South African government declared a national state of disaster and announced the implementation of various interventions, such as travel restrictions and the closure of schools throughout the country. The University of Pretoria closed on that day as well. And from that day onwards until now, the university has functioned under various national lockdown levels. This means that the university could not function as it did prior to 2020. Indeed, it has had to function largely online. And it was within this context that the university and its community partners had to rethink the community engagement projects that form part of the university's curriculum. Today, we will discuss how community engagement continued during 2020 and 2021 using a hybrid approach. And our panelists today are, firstly, Hanekom, the director of the Law Clinic at the University of Pretoria. The second panelist is Helga, lecturer in the Department of Occupational Therapy, also at the University of Pretoria. And finally, Professor Antoinette Lombard, head of the Department of Social Work and Criminology, also here at the University of Pretoria. Each of these speakers will do a short presentation on how they have managed some of their community engagement initiatives in hybrid format in recent years. I want to remind the audience here that they can post their questions to the panelists in the chat box during the course of the presentations. Following the three presentations, the panelists will answer the questions posed. And now I hand over to Hanekom.
Good day, all of you, all over the world. I'm Hanekom, the director of the University of Pretoria Law Clinic. And I will address you with regards to our response to COVID and how we are slowly moving to a hybrid approach in community engagement in law at the Law Clinic. It is important to understand what the goals of the UP Law Clinic is in order to gain some context as to what our responses could be. And of course, community engagement for a law clinic would be to provide quality-free legal services to the indigent and those of a low income of the community. Thereby we increase access to justice. And we use the clinical legal education model or CLE model in order to disseminate knowledge to students and also to candidate legal practitioners. We use the practice of law. A law clinic in South Africa is, in fact, a real-life practice, legal practice, similar to a legal practice that you will find in private practice. Therefore, we are not only employees of the University of Pretoria, but we are also subject to the codes of conduct of the Legal Practice Council, and we report to them quite apart from our reporting duties to the University of Pretoria. So the clinical legal education part is where we train students in practical law. We use live client cases. And then we also focus on access to the profession and transformation in order to appoint candidate attorneys to get them into the profession where they come from previously disadvantaged groups where they would not easily be employed. And they too then dabble in live client cases. They appear in court on behalf of the clients, those of low or no income. And of course, all of this is aimed at building a society based on democratic values, social justice, and the rule of law. Our main focus would be pro bono legal services, and of course, community engagement as such strengthen the reputation of our faculty, and it makes our dean happy. But we are committed to community engagement. And as such, we are not statistics driven. We try to, as is our duty, to find cases that has got proper merit or cases where we should be able to protect the rights of a client. We identified the need around about 2016 already for all university law clinics to develop and create electronic systems. And at our university law clinic, we have the Law Clinic File Management System, or the LCFMS as we call it. It's an electronic file management system. It's being upgraded. It's in a transition phase. We were fortunate enough that we implemented it a few months before the COVID lockdowns, and that was quite coincidental. We did not even suspect that a COVID lockdown would happen. But it really saved us, and other South African university law clinics are interested in acquiring it as well. Pre-COVID, our students were on premises, up to 130 final year law students. Practical law is a final year elective module, and they had one formal double lecture per week, but also firm meetings every week on premises. And they would come and consult with real clients on premises. The students do the work. They do the drafting. They draft pleadings, affidavits, notices, and court documents. And those documents traditionally had to be filed and served physically on the opposition and at courts. Court appearances were physical and at court, and evidence and documents would be collected from the clients and placed on a paper file. Now, those documents generally would remain paper-based, and of course, they would have to find their way to the court file as well eventually. So, sustainability of our model when COVID struck and business continuity, of which we were always quite aware, was first and foremost, and we already knew that a hybrid approach was on its way. Initially, we had to work from home because the University of Pretoria locked us out of the premises, and that created quite a conundrum, because we could, by way of permits that we were issued with, we could practice on the sidewalk, we could practice at court, we could practice at any house, but we could not practice at our premises. And all our electronic support systems are on the premises. So I will confess that some of the senior members did from time to time slip onto the premises to do scans, without which we could not gain anything. We started using Blackboard Collaborate, an audiovisual communication system to communicate with the students. That was quite successful. We also reinvented our physical two-day student orientation camp at the beginning of the year. It's now a virtual camp, and it'll remain that way. In that respect, the hybrid approach has taught us a lot, and it is quite effective. And the students in this virtual orientation is being taught how to do virtual consultations and firm communication, and that can easily be translated to physical consultations and communications. This is just the background of how the LCFMS electronic file system works. We can do announcements. We have supervisory access to it. We can see what the candidate attorneys and attorneys do. It's quite onerous to do notes and documents because it has to be typed onto the system, but it gives us a good idea as to how many files we've got, what is going on in every file, and where we are going with the case. We were fortunate enough to onboard the staff members prior to COVID. As I said, this was coincidental, but it helped us a lot during the lockdowns because we could communicate with each other through the LCFMS system. And the supervision was continuous, it was effective, and we will never not function without such an electronic system ever again. It taught us a lot as to how that works. Initially, because we were locked out of the premises, myself and some other supervising attorneys had to go and deliver the paper files at the houses of where people were doing their lockdowns, because everything was not translated or transferred into the LCFMS at the time, because we did not know COVID was coming. At this time, we have progressed quite far as the translation of paper work into the electronic system is concerned, but it's a huge venture. It doesn't happen overnight. And it's a continuous venture. Our students studied from home. They consulted with their clients virtually through Blackboard Collaborate, and we supervised them. The clients came to the premises, and they could then see the students on screen. The students could see them. And unfortunately, the attorneys, the supervising attorneys, had to do the scanning work for the students to gain access to any documentation or evidence that the client brought with them. That creates a lot of work actually for the supervising attorney, but it was useful and it was quite effective. There is a few photos. On the left-hand bottom side, you will see two of my young female, an attorney and a candidate attorney. The first virtual admission that we did from my office. What you can't see is the judge's face on the laptop there. So that was quite a challenge for us. The queues at court in the middle, you can see, were extensive, and it has not gone away. The queues at court are still there. And initially, due to the fear of death, myself and one of the other attorneys decided that we will have to give an example, and we went to court. On the right-hand side, you will see my first venture out of the house to court with my gloves and my mask, not knowing what's going to happen to me, whether I will live or die, but it worked out fine. Left-hand bottom, a notice, Legal Aid South Africa, that is supposed to render legal aid. We quickly found that notice on their door and on their website. They simply locked down for 6 weeks or so, the first day of the national lockdown being the night of 26 March. So we had to pick up a lot of pieces, not only at the University of Pretoria, but also at other university law clinics, as far as that is concerned. Legal service to the pro bono to the community. I've already spoken about our candidate attorneys and other attorneys. They would follow the same system. They would consult with clients through Blackboard Collaborate, but also follow-up consultations. And of course, this is now stuck. This is what we do, or if possible, done through Zoom, MS Teams, or Google Meet, or whatever the platform is. And we try to keep up with the various controls on the various platforms. Court appearances, unfortunately, still physical and at court, except for the high courts that's got the electronic, the case lines electronic litigation system. It's still in a transition phase. It's not been rolled out throughout the country, but we were lucky enough to have it here. And technically, some cases could be done virtually in total, but we had to have the evidence then scanned from our offices into their system. But some judges then required the original paper documents to be filed at court. Some judges directed that we should actually come to court and do the case there. And some judges had us deliver the original paper documents to them at their homes even, which was quite a curious experience for all of us. So the high courts assist us to a certain extent with our LCFMS system. That's a parallel system to the case lines electronic litigation system. But the lower courts, look at the bottom of that slide. There's nothing. There's no development. There is no electronic communication whatsoever. And that is a challenge that the law in South Africa would have to take up. At this stage, it is really not conducive to a hybrid system at a university law clinic. Thank you very much.
Thank you very, very much, Mr. Hanekom. Thank you for that stimulating presentation. I must say that the system that you described, the law clinic file management system, appears to be quite a progressive system. So thank you once again. Our next presentation is by Helga Lister, and I'm going to ask for her to do the presentation.
Welcome to our presentation, Integrated, Interprofessional and Interdisciplinary Community Engagement, a Hybrid Approach, facilitated through the Occupational Therapy Department. My name is Clarice Greiling and I am currently a fourth-year occupational therapy student at the University of Pretoria. During our fourth year, we are placed in one of three communities in the city of Tshwane, namely Daspoort, Mamelodi or the Inner City, for our Curricular Community Engagement module.
Hello, my name is Helga and I'm this module coordinator. In terms of the year organization, we have 3 blocks, each consisting of about 15 students, and therefore each community has between 4 and 6 students for 6 weeks at a time in the months indicated. The students have various learning outcomes that they need to reach, including the activities listed above. In everything we do, we follow a participatory action research process combined with the O2 process and adapted, which has been outlined here. Within these communities, we have long-standing relationships with various organizations, sites, and programs.
Hello, my name is Sipho Nhlapo, and I am a client at COSAP. COSAP stands for Community Oriented Substance Use Program. COSAP provides harm reduction service for persons using substance and their families in the community. It was established in 2017 as a collaboration between the University of Pretoria's Department of Family Medicine, the City of Tshwane, and the Gauteng Department of Health and Social Development. OT students started conducting group sessions at Mamelodi COSAP towards the end of 2018. They did group therapy sessions, which include, amongst others, life skills training, constructive use of leisure time, vocational and pre-vocational training, and social participation and support. These topics were based on the discussion we have with them at the beginning of each block on the priorities that we have as clients. We even learned how to build a gazebo and create a fence around our vegetable garden.
Over time, however, we had to start asking ourselves some serious questions. How can we advocate for structural change? How do we manage sustainability when students are transient and when these students are fulfilling an essential service that is not otherwise offered by the Department of Health, Education or Social Development? How can we see the impact on intervention and services when information is not clear and there is not a thorough record or awareness of what has already been done in the past? And how do we as supervisors manage numerous facilities, relationships and complexities with limited resources? But these were our questions. What needs did the community members have?
Many of us in the COSAP program really want to share our stories. It is something that we find healing and empowering to do, and we can make sense of what happened. When we try and warn younger generation to not make the same mistake that we did. We have also been confronted with the reality of the withdrawal of funding from the city of Tshwane for the COSAP program. As you can see here from one of the stories that was shared by another client, he was unable to join COSAP due to limited funding for methadone for new clients. Unfortunately, after sharing his story, he did not return to the program. I understand that this is the same with much of the homeless work being done in the city. Shelters are getting closed down and people are having to move.
During the USR Summit at the beginning of 2021, I listened to Tandiwe Machobeni from Rhodes University share about the community-driven digital storytelling. And from this, our own storytelling project was born. We received funding from UNICEF's Generation Unlimited and UP's One Health for Change cluster. Incredible how within a very short period of time, this resonated with so many other disciplines. Through existing relationships, we developed new ones within architecture, engineering, information design, theology, and art.
The questions that the storytelling project wanted to answer was, firstly, what are the lived experience of these community members in the city of Tshwane? Secondly, how best are these stories put together and presented authentically? Third, what information can be gleaned from their stories to help improve service to vulnerable communities in the city of Tshwane?
One of the end products in this project is the creation of 2 ebooks. In the representation of the stories, we followed a continuous authentication process in which the clients themselves had ownership of the themes developed, the way in which the ebook is presented, and the content. Important to note is that the publishing students who produced the first draft of the ebooks never came to the community. However, through the collaboration with the OT students, they were able to offer a community-centered end product.
Here are the 8 themes that came from our stories. As already stated, many of us were introduced during adolescent years via peers. We therefore really want to work with learners. And so last year, we started prevention work in the schools in Mamelodi. This year, we are going to use digital means to be able to expand our work to the other primary and high schools, and therefore have a bigger impact.
This project will be facilitated by a team of IHL students, 2 COSAP clients who were trained in digital storytelling with Dr. Martina Jordan, COSAP staff, and a primary school to produce a substance use prevention toolkit.
Another example of hybrid community engagement is the advocacy and marketing work that we do. On a weekly basis, and after consent has been received, we as students submit photos to share on various social media platforms.
We are also very excited about the advocacy that we can now do through ourselves through available technology by participating in conference presentations. In some presentations, we as COSAP clients have shared our stories live from Mamelodi to the international community. Other times, like today, has been pre-recorded. We could never have dreamed that this would be possible.
Last year alone, students and community members participated in 7 national and 7 international conference presentations related to this community engagement work. We also write articles for various newsletters and websites, which include advocating for and with people who are vulnerable and increased service provision.
Another hybrid activity that emerged during lockdown came with a change to our pediatric services. Up until then, we had been running an in-person clinic in Daspoort and Mamelodi. During 2020, we moved to a telehealth environment, providing one-on-one services. This involved the training of mentors, students and staff to enable therapy to occur with the support of caregivers in the home of the children. There was an instance where we even trialed provision of interprofessional services with a speech-language pathology student and an OT student working together with a client. Another online activity during 2020 was the training of staff and volunteers at the shelters during lockdown on providing therapeutic groups using activities for the homeless. When the OT students returned to in-person CE activities, we continued with the virtual student support and development through Thursday afternoon reflection sessions. As you can see in these pictures, students would participate in an activity, in this instance drawing an image of how they were feeling about the practical at that point, and then share it with the others and explain the meaning. It was incredibly valuable to realize how therapeutic this environment could be, even on the other side of the screen. As students shared, they were experiencing an installation of hope, universality, altruism, and a sense of belonging. When the university's COPC research unit approached the OT department to inquire about the symptoms of burnout they had observed in their clinical associates that were working in community-oriented primary care settings within the mining sector, we used the lessons already described here to suggest the implementation of a virtual 8-week group therapy program. The organization OT Grow facilitated the implementation hereof and ran the Unsung Heroes project, supporting 100 clinical associates by creating a safe space to tell their stories, re-listen to the self, experience that they have impact and value, instill hope, and build resilience. As far as we know, this project was a first of its kind. Deep change in individuals was reported on. One of the participants said, "Befriending my fear gave me back my control. It has been liberating." The final important hybrid development is that of our online block management system. We use shared drives for all the work that we do now, and when disciplines become involved in the communities we are working in, they gain access to those and have to upload the work that they are doing onto the system too. Together with the strengths, there are numerous challenges. We have already made contact with the Department of Informatics, and next year we are hoping that for one of the third-year groups, they will be developing a user-friendly, sustainable data management system. There are so many other collaborative examples I would love to share. We're in this hybrid space, and by bringing people together, incredible work has been done. As we look forward, amongst others, our plans involve the training of community members in online assessment procedures, so that they will be more active contributors into Africanization of our curriculum and ensuring it is community-oriented. We would like to acknowledge our community partners, our clients, the students, and the team of lecturers and supervisors who have made it a priority to work collaboratively. It really is when the puzzle pieces fit that the magic happens. And as we have seen in our country, when we work together, we really are stronger together. Thank you.
And thank you so much, Helga. We are now going to move over and request Professor Lombard to do a presentation. But before she does so, let me remind the audience to please type in your questions in the chat box. We will accumulate them and respond to those questions after Professor Lombard's presentation.
Thank you, Professor Duncan, for the introduction. Good day to everyone across the globe. I'm going to share some projects of final year social work students with you. In South Africa, the social work program is 4 years, and in the final years of study, the students have to do an internship in various organizations. Now, the particular group that I'm going to talk about, 2 projects of 2 students from 2021. Now, these students were in the previous year, they were completely just on an online learning experience. So it was very important to bring them in the 4th year back to campus and also particularly to the welfare organizations, the various NGOs, CBOs where they were working and had to implement their practice. They all had to work with one-on-one clients, also with groups and then with a broader community. Now, in terms of, I'm going to share with you 2 projects. The one is on nurses' wellness amidst the COVID-19. Both of these projects obviously was in the context of the COVID pandemic. And the first one was then in the Steve Biko Academic Hospital, and it was with Lexi Simmons that were involved in that project. And the second one was a podcast for older persons during the COVID pandemic, and that was from the Linwood Reach Dutch Reformed Church congregation. And Minke Bidolf was the student that worked with that project. And I also want to give credit to our supervisor, Mrs. Elmine Claessens from UP, who supervised the students. Now, in the organizations, each student have also a local supervisor that they work with in collaboration with the university. Now, if we look at the first project, vernieuwend, which is, if I translate it, it means to rejuvenate, renew, restore. And that was really bringing new thoughts and habits into the environment of the older persons at the church community. Now, as we all might know, that the older persons were very, very isolated during the COVID pandemic. They were not visited by their families, their loved ones, and in the church, neither could go to church. So the student then started with a needs analysis, and she interviewed older persons and then realized that they really, really need some connections in terms of their physical and mental health and their well-being. So the student then developed a podcast series, which was not limited to the older people, anybody else could, but it was mainly targeted for that purpose based on what they said their needs were right there in that specific community. So they identified the themes and they took ownership of what they wanted to see on the podcast. It was distributed then via the app, and that was developed also by a person within the church community, which was an IT specialist. Now, the aim was then to strengthen their social connectivity and to improve their physical and also their mental health. Now, there was daily inspirational messages from the pastors from that church community, and then there were podcasts from health and psychosocial tips from various disciplines, including health, doctor, nurses, psychologists, and social work. And then also the exercise routine by physiotherapists and also by kineticists that they could download and then practice along with the other older people in their own environments. Now, the question is then what happens afterwards, because the student was responsible not just only to work with the individuals, but to also continue in working with group sessions. So what was the beauty of this connection on the podcast and connecting with them via telephonic interviews for the themes is that when the circumstances changed, these older people then came to the church community and started to meet one another face to face again in a group series. So that was very valuable for them to actually share their experiences, what it meant for them to actually have these podcasts, and they discussed that and the experiences of isolation and how it kept them connected and mentally sound and physically active by having these podcasts. So they shared this on a face-to-face basis, which was then facilitated by the social work students. And the good news of this project is that it's continuing because the student handed it over to the church community, to the leaders. It was developed within the community, and it was just easy to continue by the community. The second project that I want to share was from a student that worked in the Steve Biko Academic Hospital. And also starting working with the social development department, wanted to say, what will we focus on in terms of the hospital? And then they discovered at that really the height of the academic and the burnout and the overwhelming experiences, overworked experiences of the nurses. And that they were obviously, it's very difficult to find them in one place because they worked at shifts, but they were desperately in need of some support services that were available at the Steve Biko in terms of links and resources, but it was also found that they not really knew about them and neither used them. So also doing an analysis with the nurses themselves, determining the needs and their themes, what they would like to receive from the social work student. They created a WhatsApp platform, which then became a supportive network that was accessible at any time, and it was inclusive. And at that point, 40 nurses joined this WhatsApp group. So there was posted on a daily basis for a period of 8 weeks, videos and resources in terms of how to cope with various aspects of their needs, in terms of emotional, physical, spiritual, and then financial wellness, and how to deal with these issues that they were facing. And the nursing staff engagement, they could connect with one another on the group without the professional, the social worker that was involved. So they were all connected. So they could, at any time of the day and night, reach out and connect with one another for support. So they linked, the social work student also linked the nurses then with the hospital resources and networks like Hospivision and South African Depression and Anxiety Group that they could also link with at their own time. Now, in the same instances as the previous project, the student also had to continue with working in a group context. And at that time, after 8 weeks, the nurses were ready. They were also more connected with one another. And then some of them turned up for the group work series, which was then face-to-face. And they met and shared their experiences and on the themes, but in more depth, and sharing what they've experienced and how it worked and what the further challenges were in terms of supporting one another and how they were coping and how they were dealing with the fatigue and all the other emotional and other physical challenges and mental challenges that they faced. So the topics on WhatsApp were discussed in more depth and created an opportunity for them to actually be interactive with one another. So also in summary, in this final, in terms of the outcomes, they improved, their well-being were improved, they felt better about themselves, more confident that they're not alone, they're not coping, they have to not struggle coping by themselves, that they can use one another for support. Ongoing support network, the WhatsApp group could continue and they could support one another at any time. And then that also had a ripple effect on the patients because they felt better themselves, their attitudes changed, they had more energy and also back into their homes and their communities. So also then finally having better self-care and looking after themselves. Thank you.
I thank you, Professor Lombard, for that comprehensive presentation on some of the work that your students are doing. Now, ladies and gentlemen, colleagues, participants on the platform, I've got the three colleagues here with me in the studio, Eddie Hanekom, Helga Lister, and Antoinette Lombard, and they are going to answer the questions that are posed by the audience. And I've got one question here by Erika Brondo. It's a fairly long question, so I'm going to ask my colleagues to pay attention. And then I'll ask one of you to respond to the question. The challenge of doing service learning alongside community engagement is balancing student impact and community impact. How did you create that balance in your projects? What about for those doing interdisciplinary work where you're balancing learning outcomes of different disciplines as well? Can I start with you, Helga, the first part of the question? And I'll repeat it. The challenge of doing service learning alongside community engagement is balancing student impact and community impact. How did you create that balance in your projects?
Thank you for the question. It really is about looking at what the community comes with first in the analysis regarding their assets and the needs that they have, and then seeing how the outcomes that need to be achieved from a curricular perspective can be embedded within that. What we have realized is once it aligns, by also communicating with other disciplines and their learning outcomes, the synergy very quickly develops. As an example, we have this community-centered approach where we do the PRR process at all the various sites, but then by working collectively, we are able to see how they can then fulfill certain outcomes as part of that, the need that's been identified. For example, the health awareness events. They need to do a health awareness event as part of their outcomes, but it is something that already came out from the community, and hence we had the opportunity to now have ongoing health awareness events at various schools.
Thank you so much, Helga. Eddie, do you want to respond to any aspect of those questions?
Yes, I suppose the balancing act at the UP Law Clinic is more focused on the fact that we don't necessarily try to disseminate knowledge to the students through service learning, but we are developing skills and applied competencies. And as such, the community approaches us with specific problems, but any kind of legal specific problem would be conducive to skills development and the development of applied legal competencies. So the balancing act in that respect is very much based on what the community member brings to us and what the outcomes would be, and it almost automatically then gives us the opportunity to have the student engage with the community member and then get to the required outcome as far as skills development is concerned.
Thanks a lot, Eddie. I'm not going to pose the same question to you, Prof. Lombard, but I'm rather going to ask you, pose the following question to you. How can a hybrid model strengthen community and professional partnerships?
Yes, thank you, Prof. Duncan. I think what we see in this project specifically is that it was within the community themselves, firstly in the church community, that it was all volunteers that came together. If one thinks of in a normal face-to-face environment where you invite a few specialists to come and speak around the table, how long it takes to get everyone together. But in terms of the virtual aspect of it, it was very easy to have the core group, which is the older people, knowing what their needs are, to bring them all together. So the partnerships was actually organically just developed naturally. And by the time then that they saw that they met physically in the group, the discipline also knew one another, different disciplines, and in terms of supporting one another, while they also were supporting the community themselves.
Thanks a lot, Prof. Lombard. There's another question for you from the audience, but I'm first going to pose an additional question that had been earlier asked by one of the audience members to Ms. Hanekom, and this comes from a participant or in the Eastern Cape. She asked, can you tell us a little more about the online block management system? I assume that she's referring to the, what do you call it, the law clinic file management system.
The file management system. Yes, the file management system, let me first start off with by saying it requires a buy-in from all staff members, because every staff member is loaded on the file management system, and all communications would then have to be typed into that file management system in order to create a proper database. The consultations that we do, usually on a paper-based file system, you would write down consultation notes with the appropriate dates and times, and this now has to translate into a typed consultation note. We have quickly realized during the course of 2020 and early in 2021 that we need a function in order to upload documentation. So if a person is uncomfortable with typing or cannot type, and that is one of the challenges that we actually identified, which we did not think of. A lot of the young people cannot properly type. We assume they can, and myself, I'm also in that category, but that can be rectified. But now we have the function where they can actually write it down and then simply upload it, and we have the full set of consultation notes on there. The supervisors have got constant access and they can type notes. The staff member can also type questions, and there is also an announcement system where we can put out general announcements to everybody on the system. And there's a constant communication and interaction between the person in charge of the actual case, the actual file, and the supervisor or supervisors. As far as documentation is concerned, it's not perfect because it's not linked to the case lines system, but it's, we call it a parallel system. So what we do on our system, we can easily duplicate that onto the case lines system if the staff member actually properly manages it. Statistics, it's a fantastic system as far as statistics are concerned. We can also identify when we have duplications relating to cases or where there might be inconsistencies like identity numbers or passport numbers, for instance. This system is developed far enough for us to get red flags as to where we should now investigate who are we serving or not, and why is this case with us? Is there perhaps, and I shouldn't really belabor this, but is there perhaps an ulterior motive other than the real need for pro bono legal services? And in this respect, the system is quite functional and useful.
Can I ask a personal follow-up question, Ms. Hanekom? If we had not been required to go into lockdown, how much longer would it have taken to develop the system? Was the system's development facilitated by the fact that we could not be on campus, or would you, in normal circumstances, have progressed as rapidly?
Curiously enough, the answer to that is we would have been exactly where we are today.
Okay.
It wasn't accelerated because we already identified the need quite a number of years ago.
Okay.
We just did not know that we would have to rely upon this system that much, that quickly. To accelerate it, maybe I should say, of course, the IT support is extremely important. We were lucky enough to have a staff member that is trained in IT. Lawrence Grevere, he was the basic developer of the system. And unfortunately, he's not at the clinic now anymore. He's now into academia. So that is a huge challenge for us. How do we replace him, and how do we interact with IT in the broader university sense to facilitate what our specific law-based needs are? But it is something that we are constantly brainstorming, and I'm sure we will find an answer to that challenge as well.
Well, thanks a lot, Mr. Hanekom. Back to you then, Professor Lombard. Firstly, this audience member says, thank you for all the presentations. I'd like to ask, how do you get the students inspired while participating in your projects? And did you find that students were more or less motivated to participate in community engagement after completing their courses?
Thank you, Prof. Duncan. I think what stimulated, especially the digital environment also, is that in the third year, these students were exposed to only learning on that platform, and they had opportunities to engage in case studies, in working with different individuals and group, and connecting with one another and supporting and learning how to do this. So our students gained confidence. They were, when they got to their fourth year and there were no alternatives, they had the learning outcomes to had to be met. And there were the restrictions in terms of access of the real life clients. So they were actually forced and inspired, I think, by the previous learning on online activities to say, let us just force our ideas and stimulate one another to be innovative, to actually bring the real face client aspect together with the digital and bridge that. And that made the intervention actually very strong.
Okay, thanks, colleague. By the way, this question came from Andrea Dutoy. And my own experience, I mean, or my knowledge of some of the projects in EBIT indicates that very frequently those students who do community engagement work as part of their curriculum, even after they leave the university, they retain contact with those communities. And I'm wondering whether that is the same, is the case with your projects as well, Helga?
Definitely. And I think for me, the most rewarding thing is when at the outset, students who are incredibly marks focused and want to know exactly what do they need to do to achieve really good marks. And we say, the community, things are messy. Mm-hmm. You can't always rely on things to happen the way that you're planning them to happen. Meetings get cancelled, there's rain, you won't be able to run a group therapy session or something else will happen. And at the end of the 6 weeks, the students come back and they say, it's not about the marks anymore. For now, the most important thing is that we actually make the biggest difference that we can whilst we are here. Mm. And then we know that the real switch has happened, and we see it time and again with our students.
Thank you so much. I'm going to try to follow up here with a few more questions. I've got a question here from someone whose surname is Dao. We would like to share today's speakers' presentations in a creative group. Are the presenters agreeable to that? Okay. So there you've got your answer from this audience member. Then I would like to follow up with another question now. What support structures, Helga, do you think are required for hybrid presentations, given our experiences of the past 2 years, and given the importance of community engagement? I think community engagement is so critical, both in terms of the service that we provide to our communities, but also in terms of what it offers our students. I mean, it offers students invaluable opportunities, but are our systems adequately calibrated to really push a hybrid instruction or hybrid engagement in communities?
Thank you so much. Yes, I think it's important to know that hybrid community engagement cannot exist without students and staff being embedded in the community. So some always have to be there in order for true community development and change to occur, because relationships need to be built, trust needs a period of time to develop. And the way that we can support this is through the employment of community liaisons that work within these various communities. They could be responsible for coordinating projects, working with the various disciplines and professions, and ensuring that the face of the university is easily recognized and the scene is consistent. And secondly, unfortunately, when going hybrid, it's not a shortcut to limit much needed funding. The students and staff that are embedded within community require support in terms of funds for transport, for example, so that it can enable them to meet directly with the community members and be present, especially for those students who won't be there.
Absolutely. Helga, if I may also add, and I know I'm not supposed to do this, I'm supposed to chair and only pose the questions, but you've raised an important point, and that hybrid really means to engage in person with your clients or your community members or your students, and online, and that the one really reinforces the other. And I want to ask Ms. Hanekom then, to what extent does online affordances sharpen or improve or enrich the student experience and the value of the proposition to the community?
As far as the student experience is concerned, I think they gain more skills through the online teaching that can easily be translated back into physical skills when they are face-to-face with the clients, because now they have the additional burden of dealing with the electronic management of the communication systems, which previously simply did not exist. And in our case, they also quickly realized that it is very useful, and that is something that we taught them as well when the interactions were still physical, that it would be useful to have someone to manage the process. And that someone has to be their own firm's general manager, and they would have to appoint him or her. And they also would have to distribute and allocate tasks, not only as far as the content of their engagement is concerned, but also as far as the management of the electronic communications are concerned. So I believe it creates a platform to disseminate more advanced skills than before.
Thank you. That's my view as well. But I mean, it's always useful to hear the views from different departments or disciplines. I've got another question here that I think can be answered by all three of you. So, we have about 8 minutes left, so we'll try to be brief around this because I've got additional questions to pose. And where's the question now? Here it is. For all the academic programs, how many service hours are students required to do? From those hours, how many are face-to-face and how many are online? I think that relates to the comments you had made earlier, Helga. But just in general, Prof. Lombard, I mean, your students have to put in quite a number of hours, but if our international audience can hear what our expectations are of our students.
Our students average on the fourth year, it's between 16 and 20 hours a week. They have to be in the organization, in the field.
Okay, so they would engage with the community in person, but you also use online?
Yes, they in this case where we had the online opportunities, but they have to also make connection with them on a face-to-face basis. So basically use both. And then for the classes, for the theory classes, they have to be on campus, face-to-face.
Okay, and that's an ideal mix, I think. Helga?
Yeah, the Health Professions Council requires 1,000 hours at the end of the degrees in terms of practical experience. And when COVID happened, they did allow a portion of that to be done through alternative online means, for example, the telehealth that we implemented, or using alternative case-based work. But it also depends, you can, when the hybrid work happens, ensure that some of that aspect around the electronic management system is part of the training and part of the community work that has to happen. So whilst it might be virtual, it is a part of the hours.
Okay, so that's quite significant, and it's 400 hours spread over 4 years.
1,000 hours over 4 years.
Over 4 years, wow. Are there any aspects of the online provisioning that you'd want to retain beyond the pandemic? I mean, when we emerge from the lockdown context?
Definitely. I think in our examples, we have shown how we can have such a wider reach through the online that extends to the entire South Africa, and I'm hoping maybe even from this webinar going internationally. I do think that there are more efficient ways of doing things online, for example, the management of the systems, or being able to run therapy sessions or group sessions online when you're trying to reach a wider audience across a greater field. However, it never replaces in person, and that I think has been the key aspect of the presentation.
But one valuable point that you're making there, it means that if one uses online affordances, your reach can be so much further. At the moment, and it's good that we're located and firmly entrenched in the communities that we serve, but some of the value of what we do can in fact be pushed out to people further, geographically speaking. Eddie, do you have any additions to make in relation to this question? Or firstly, let's tell us first how many hours your students have to put in.
We are approximately at 120 hours per year. It is an elective, but it would generally translate to much more because the students would have to have their own firm meetings that are not necessarily supervised in order to create their own platforms as to how they're going to manage their cases as well. There's also no split between how many hours should be online or how many hours should be physical. There's never been any guideline as far as that is concerned. That when the pandemic hit, nobody actually thought about how that is going to be controlled in future, because we immediately went totally online initially. Now we are coming back to having the students physically on campus. So it's the first time we are actually sitting down and thinking, should there be a split between the physical interactions with the students and with clients and the remnant of the rest of the hybrid interactions.
Thank you, Eddie. I see that we've got 4 minutes left, so I'm going to ask each of you if you want to make one concluding remark, and then I would want to read, or perhaps I should first read some of the comments sent by the audience to give you a sense of how your presentations had been perceived. The first one here is excellent presentations. The second comment is such great work, Helga and team. Thank you for sharing. And so the list goes on, a number of these comments. So I do take I suppose, comfort in the fact that the conversation that we have had here today has been found to be informative and instructive to more than ourselves. I'm fascinated by what you had shared. I'm fascinated by the work that all three the departments represented here are doing, but it's comforting to know that there's value to what you are doing beyond the university and the communities in which you are working. So over to you, Eddie, and then I'll come down the line for any final comments.
Concluding remark from my side, it's a privilege to be involved in community engagement. As far as development at the UP Law Clinic is concerned, we are, I suppose, one step ahead, and then we have to lag behind what I've pointed out at the lower courts, who are really far behind in catching up relating to online communications and online litigation systems. So we have to manage both. We are in a transition phase, and we simply cannot jump to a higher order online system because our court procedural system does not support that currently.
If I can be mischievous, shouldn't you make that one of your projects in getting the court system?
Absolutely, and we are engaging with everybody and anybody who wants to listen. I can assure you.
Great, Helga.
I think my comment is a follow-up from that, is just wanting to encourage everyone to use these opportunities to train community members on online methods and to ensure that community members are active participants in the dissemination of the work that is being done. Yes, it is a lot harder. We've spent countless hours driving to Mamelodi, and you're working with various challenges, like I mentioned, rain and data and not knowing where people are and trying to bring them from their homes. But the rewards are just so much bigger. And it is really incredible to see, once this extra effort is put in, how much more can be done, and how much more the communities themselves are actually owners of the process.
Wonderful. Thanks, Helga. Prof. Lombard?
I think in terms of community engagement, you don't reach only the community, but also the individual and the family and other groups. So it is a natural flow. And our focus is to bring, as Helga also said, to bring transformation, social transformation, to bring sustainable society. And for me, what this hybrid model is really have taught us in this last period is that our interventions can be more sustainable, because what it actually do, it brings the ownership of the project, not just determining the needs, but the people start immediately engaging in the project from the start. And where students usually have to pull out after their practice year of, moving on, graduating, etc., it is naturally left within the community, which was the co-partner from the beginning. So the sustainability in working to a more just and sustainable society is, for me, more evident in terms of a hybrid approach.
Thank you, Prof. Lombard, and that's a really powerful way of concluding our discussions today. I want to thank all three of the panelists for their really informative, instructive, and inspiring presentations, and for sharing this platform with me, just to I suppose wrestle with some of the issues that confront us on a daily basis, but also to reinforce the notion of how important university social responsibility is for the education of our students, and how beneficial it is for the communities in which we are located, from which our students come as well. I want to thank everyone in the audience. Thank you for joining us today. I hope that there will be another opportunity for us to share ideas with you, and for you to, I suppose, ask what questions you might have about the systems we utilize at the University of Pretoria and in South Africa. Goodbye then. Thank you.